Riverside County Supervisor Karen Spiegel says she and her entire family recently tested positive for coronavirus. So has this changed her perspective on the pandemic as the county looks ahead to reopening? I asked her this and several other questions, including the biggest challenge in getting the county to reopen. Supervisor Spiegel, thanks for joining us.
Thank you.
First off, let me ask, how are you doing?
You know, we are doing great. We had a whole family involved with this COVID, and it was an interesting time, but I'm glad it's over.
What were your symptoms?
My husband and I both had it, and we had completely different symptoms, which is really kind of interesting. Mine was a high fever. I ran for 7 to 10 days straight, and completely exhausted. I couldn't get out of bed. I was just tired all the time. And later on, I developed a small rash. Whereas my husband, he had the cough, he ended up with pneumonia, he still has oxygen. So, you know, we had completely different things going on. And, but he's back to work. Went back on Tuesday. So we're doing a lot better, but thank you.
Any idea how you became infected?
You know, probably familiar because I wasn't out at all. And when I'm very conscientious with masks and everything else, but I hadn't been out the week before, so it had to been brought to me, which is okay. I mean, it happens. It happens with everybody. And I don't know who it was. We don't know because we all tested positive. My kids, my grandson. So it was but they live with me, so it's obvious as, you know, you eventually catch it. But we were very fortunate, very, very fortunate.
I'm curious because obviously you've been in a lot of discussions about coronavirus and the impact that it's having on the community. Has this changed your perspective at all?
You know, it's changed my perspective how political this has gotten and how partisan. There's such a stigma now that some people snub me. I tell you, the tolerance, I mean, they make an assumption with the relation to that. And then earlier on, back in when we were first opening our county before, and I and another of my colleagues, and it went 5-0, but I was the one that was fingered of rescinding the mask order and how we're responsible. But that's not what happened. All we were doing was trying to get in line with the state. No one hears that. And so they made this as a political move. It was trying to say, let's get our businesses open when it's safe. You know, when you have the governor having orders, you have the counties having orders, and you have cities. I was just trying to make it streamlined so when the governor said you can open, we can open. Our business is suffering. And now here months later, we're even worse. So, but people are funny. They really kind of go, ooh, and then back off.
Do you still find that there are extremes on both sides of this issue?
Absolutely, both sides. You are correct. It is those that want to go and don't want to wear masks, want to get back to life as normal. And I think normal is going to be redefined. I want to get back and I want our businesses open. But if I have to pay a price of wearing a mask, social distancing, and washing my hands in order for a business to be open, I would hope that more people would take that attitude that if this is what it's going to take to get on that process, then let's just do it. It's not that horrible. And it's a safety thing. And I can tell you, it is a safety thing. I'm experienced it.
The county has proposed to the state a new reopening process as soon as after Labor Day, allowing some indoor businesses like restaurants and other things, churches. What are your thoughts on this? And, you know, as somebody who just went through having coronavirus, do you think that this is too soon?
You know, I think we're going to continue to have this. As our public health officer says, it's not going to be gone until there's a vaccine. You know, we look at this with polio. Look at HIV. It took 30 to 40 years. And the stigma that went with that. You know, we do a lot of finger pointing. And when there's the unknown, it's a lot worse. And I think, you know, when you look back on every other thing that we've experienced as a country, as a world, you know, it takes the time. And that's why I keep saying is if we have to change our normal to a little bit different just to get through this, I'd certainly like to see more people out. I'd like to see our kids with their you know, in the classrooms eventually when it's safe. I mean, the key word is when it's safe and you have your health professionals. And as you keep saying, when I went through this COVID, it's a real thing. Some people don't think it's real. I went through it. My husband's still dragging an oxygen tank around. So we know it's real. If it's avoidable and avoidable for the spread, let's try it. You know, I have adult kids, and they enjoy being out in the nightlife, but they also realize after watching us go through it that, you know, hey, this is a real thing. And if we can just get more people understanding that just taking a little step of slowing the spread could help all of us get back to some type of normal.
And if the reopening doesn't go well, because doctors keep saying that we're about to hit the flu season and they're concerned
Right.
this could be really bad, is the county then prepared to revert back to more closures again?
You know, we, as I said earlier, is that we put all of our orders in line with the state. We will follow, at this time, follow what the state says to do, unless it's and he's not been grossly off. There's been times I haven't agreed with what the state decision has been, but, you know, we've got to follow suit. And, you know, we have all the counties in Southern California, we're all the same point. Now, San Diego and Orange County have moved out of the monitoring list, where we are hoping to get off the watch list soon. But, you know, we were all in the same capacity. So if we stick together and work together, I think there's more positive and our businesses getting back open together.
What is the biggest challenge right now in getting the county back to reopening?
It's our getting our testing back up. People are no longer interested in testing. And so what happens is those that have symptoms are being tested, so our positivity rate keeps going up. Well, although it has come down in the big scheme of things, but if we don't get more people just testing, it's showing that it's only positive. Our positivity rate was double digit. We're now below that, so that's good. The governor's was 8. We're just over 9.2, I think, right now. And then as well as the testing. So we just have to keep, you know, working on that. And then our count obviously is the positivity rate of, you have to have under 200 for every 100,000, and we're below 160 now. So we've done really well there. And we're getting our metrics much better. But then it's just now keeping it down and keeping people, you know, just being a little safety, you know, let's slow the spread, mask, wash your hands, and keep your distance.
All right. Supervisor Spiegel, we're glad that you're doing better. Thank you so much for joining us.
Thank you.